Welcome to the Maternity Mentor. Today we will be talking about Rh incompatibility, the Rhogam shot, and how it could save your baby's life. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Rh incompatibility can be a very confusing and stressful disease to understand. To treat this disease, you need to receive a Rhogam injection while pregnant, but most women are unsure what this medication is or if it's safe for their baby. Let's explore what Rh incompatibility is and why it's so important to receive treatment. Everyone is born with a different blood type. These include O, A, B, and AB. Most people also know that their blood type comes with a positive or negative. For example, your blood type might be O positive. But what does that positive actually mean? Well, that represents your Rh or Rhesus factor, which is a protein that sits on your red blood cells. Rh factor is inherited from one of your parents. Most of the time, it's no big deal what your Rh factor is unless you are pregnant or you need a blood transfusion. Then it's extremely important to know if you are Rh negative or Rh positive. Only 18% of people are Rh negative, but if you are one of those people and you're pregnant or planning to become pregnant, it puts you at risk for Rh incompatibility. Rh incompatibility is when an Rh negative woman has a baby with an Rh positive man. When this happens, a baby has a 50-50 chance of having either Rh negative blood type or an Rh positive blood type. This is because Rhesus factor is inherited from either the mother or the father, not both. If the baby is Rh negative like the mother, there is no incompatibility. However, if the baby is Rh positive, you will need to receive a simple treatment. A mother always has her blood type determined early in her pregnancy as part of many blood tests ordered through normal prenatal care. Some doctors will choose to test a father's blood type if the mother is Rh negative to determine if an incompatibility could exist. However, most doctors choose to treat a woman regardless of a father's blood type, just in case, because treatment is easy and poses no risks to mother or baby. Your doctor will also order Rh antibody tests if you are Rh negative to determine if your body has already been exposed to Rh positive blood before, through an abortion, miscarriage, or a mismatched blood transfusion. This is important because antibodies fight off foreign substances in your body like Rh positive blood. If your current baby is also Rh positive, your body may recognize the baby as a foreign substance that needs to be fought off. One example of this is miscarriage, which can be caused by Rh incompatibility, when a mother becomes pregnant with an Rh positive baby that her own antibodies mistake as a foreign body and attack. Many pregnancies can and will continue despite Rh incompatibility, so your healthcare provider will monitor your baby with blood tests and ultrasounds. If a problem exists, they may give the baby a blood transfusion through the umbilical cord prior to birth. Additionally, they may recommend an early delivery for the health of your baby. The nice thing is that women who are experiencing their first pregnancy usually don't have to worry about Rh incompatibility because it takes longer than 9 months to develop antibodies. When a mother is Rh negative and the father is either Rh positive or unknown, the treatment is Rhogam. Your baby's blood type cannot be confirmed until after delivery, which is why you will be treated prenatally to prevent complications. Rhogam is a medication that prevents your body from making antibodies to Rh positive blood. These are the same antibodies that could attack your unborn baby. Rhogam is given to a woman whenever there is a possibility of the baby's blood entering an Rh negative mother's system. These instances include after any invasive testing such as chorionic villus sampling and amniocentesis, after a miscarriage, stillbirth, abortion, or ectopic pregnancy, after any trauma to your abdomen, including a car accident or fall, between 26 and 28 weeks gestation due to placental thinning that rarely causes the baby's blood to enter the mom's circulation but is possible, if you're experiencing vaginal bleeding during your pregnancy, if your doctor must manipulate your baby like an external version, which is an attempt to turn your baby from a breech position to a cephalic or head down position, and within 72 hours of delivery of your baby, including a cesarean section if your baby is Rh positive. You will also receive Rhogam after delivery, even if you've had a tubal ligation and your baby is Rh positive. You do not need to receive the Rhogam shot after a chemical pregnancy. For more information on genetic testing during pregnancy, like chorionic villus sampling and amniocentesis, please check out our video on this subject. We will link that in the description below. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about administration and side effects of Rhogam. Rhogam is a prescription medication that is administered through an injection or a shot into your muscle, usually your thigh or buttocks. Once a Rhogam shot has been given, it will be effective for approximately 13 weeks. However, there are different dosages, so your healthcare provider may determine you need an additional injection earlier than this. Rhogam has been used for over 50 years and is a very safe medication for mothers and babies. The most common side effects are injection site reactions, including swelling, redness, hardness, itching, and pain. Other side effects include headache, muscle and joint pain, a slight fever, and fatigue. Rarely, patients may have an allergic reaction. The baby, however, does not have any side effects from the Rhogam injection because it does not cross through the placenta. You should not receive the Rhogam shot if you have hemolytic anemia, if you're allergic to immunoglobulin, if you've recently received a vaccine because Rhogam will reduce its effectiveness, or if you already have Rh positive antibodies. Rh disease does not impact you or your health at all. However, Rh disease can have serious impacts on the health of your baby. It can also affect future pregnancies. 20% of women who choose not to receive the Rhogam shot will develop Rh disease, which means they become sensitive to the Rh positive factor. If this happens, your baby can be born with the following complications: anemia, brain damage, and heart failure. Rh disease also increases the likelihood your baby will develop jaundice. Luckily, most Rh incompatibility produces only mild complications, and your healthcare provider will be monitoring your baby very closely. For more information on newborn jaundice, please see our video on this. We will link that in the description below. Rh incompatibility is easily treated with the Rhogam injection. This life-saving medication can help your baby now and all your babies in the future. I hope this has explained what Rhogam is and why you should consider treating your Rh disease for the health of your baby. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family, and follow us on Facebook, Instagram, and Twitter for additional information. We will leave that in the description below. Thank you so much for joining us at the Maternity Mentor.